Hey guys, it's Dr. Nelson. I get to explain another thing we help with, which a lot of people do not realize that chiropractors can help with, and that is helping to normalize sense of smell. Now, a lot of people have been dealing with this for the past 4 years, some disturbances with those, and we found a lot of improvements with sense of smell from people who have completely lost it or lost parts of it, getting in some or in a lot of cases, a lot of that sense of smell back, or actually having no symptoms of that loss of sense of smell anymore. I have to speak carefully here, so I hope you appreciate where I'm coming from doing this dance. But let's take a look at this and why this is and what we can do about it. So we're looking at a cross section of the head kind of going this way, and what's highlighted here that's supposed to be is not the eyes here, but that's supposed to be the what's called the olfactory bulb. The olfactory nerve is cranial nerve 1. It's the one responsible for your sense of smell. All of that mumbo jumbo to say this is the part of the brain that gets particularly inflamed, and this is why people had what they called COVID brain, is because this part of the brain right here up front is responsible for a lot of thought, a lot of intentionality, a lot of clarity of mind and decision-making process. Well, it's also the part where you process a lot of your sense of smell. And so when that gets really inflamed over here, the nerves don't work properly. And so a lot of people have given up thinking that their sense of smell was gone, when in fact it was kind of hiding just underneath the surface. So if we make this graph over here and we say like, hey, like you have to have 50% inflammation, let's say, for this to lose it. If you're hanging out right here and we can get you up right there, things could still be somewhat inflamed. We can just help improve that inflammation in the brain, and all of a sudden your sense of smell comes back in a big way. And so what we found is that if you combine peppermint oil, now peppermint essential oil is very, very good at helping to open up and increase the blood flow and increase the oxygen delivery, especially to this prefrontal cortex of the brain. Very, very good at that. Now, you want to make sure you get quality. I've got videos about talking about quality and the types of oils I recommend. If you want to watch those, go check those out. Excuse me. But the other thing that we do is we provide red light therapy. And what we're just trying to do here is to decrease the inflammation in those nerves and try and get that back towards normal, healthy brain function. And so it turns out the first thing you want to do is you want to put laser on the brainstem right over here. This part of the brainstem is in charge of distributing the blood flow to the rest of the brain. So before we work this area, we make it work. We apply the red light therapy to the brainstem here, and then we're able to make sure to normalize that blood flow distribution so that when this works, it has the support, it has the nourishment that it needs from that lower brain level right there. About 5 to 10 treatments, and we found tremendous improvement for people. So if you're concerned about your sense of smell and wanting to see what we can do about it, call us to schedule a consult and exam. I'm looking forward to chatting with you.